Healthy looking teeth and good dental habits should start from young age. To help your kids have a healthy smile by making dental hygiene fun for them. Acharya Shri Vijay Vallabh School, Pune brings to you a webinar on dental health. Let's build a confident smile. To guide us how to take care of our oral hygiene, to make brushing, flossing, and dental checkups a positive experience by our expert Dr. Shilpa Pagaria. To make your child not only grow up with a beautiful smile but also with healthy habits that can last for lifetime. Our chairman Shri Subhashji Parmar has encouraged and led a way to us. Dental cleaning is a part of preventive oral care routine. To make our teeth stay healthy through consistent dental care, let's begin with our today's webinar. Healthy looking teeth and
A very good morning to everyone. From last few weeks, we are coming up with a very powerful, engrossing and vibrant series of Sunday Facebook Live webinars by the wholehearted support by our respected chairman Sri Subhashji Parmar sir and members of the committee. With warm greetings, I, Sonal Khabia, on behalf of Acharya Sri Vijay Vallabh School, feel highly privileged to extend my warm welcome for one more interesting and useful Facebook Live webinar on the topic Dental Health. Let's build a confident smile by our thoughtful and dedicated, compassionate dentist, Dr. Shilpa Pagaria. A healthy body is always the result of healthy thoughts and feelings. It is a perfect harmony of the mind, body, and spirit. Today, we will be focusing on oral health. It is a window, a key indicator of overall health, well being, and quality of life. It is a reflection of the physiological, social, and psychological factors that are essential to our quality of life. So, I think today's webinar on the topic dental health, let's build a confident smile is the best platform to understand about dental care. स्वस्थ मुंह सेहत का आधार है. So, everyone, let's be ready and invest your quality time to gain the knowledge which promotes the dental benefits and burst the myths about dental care and bring the shining smiles with care and cure. Now, I request our respected principal, Mrs. Snehal Kataukar Madam, to brief us about our school. Over to you, ma'am.
Thank you, Sonal. Good morning to one and all. Once again, a very warm welcome to all of you. From the bottom of my heart, I thank our today's speaker, renowned dentist Dr. Shilpa Pagaria, for accepting our request and ready to enlighten our today's webinar on an interesting and useful topic, dental health. Let's build a confident smile. He who has health has hope, and who has hope has everything. A good quality education is the foundation of health and well-being. Health and fitness plays a vital role in our life. To maintain good health and fitness at its best all the time, we need to take care of hygiene and sanitation around us. We at Acharya Sri Vijay Vallabh School, child's health is our first priority and utmost important. So we always focus and promote better healthy habits in students. Every year we arrange annual medical checkup for our students, and also we arrange various workshops for parents and children to generate positive awareness about good healthy habits. This year, our students visited the frontline warriors, the doctors, on the Doctors' Day on 1st of July to appreciate their efforts. We also run an Institute of Education and Career Development, through which we offer many sports activities for the students to remain healthy throughout the year. I wholeheartedly thank our chairman, Sir Subhashji Parmar, for the guidance and support given to us for this webinar. So today, I'm sure we are going to gain knowledge on one such interesting and useful topic related to our health, which is need of an hour and very useful. Our goal is to prevent complications of tooth related problems and maintain overall health of our mouth. Thank you. Over to you, Sonal.
Thank you, madam. Now, I would like to introduce our today's guest of honor. On behalf of Acharya Shri Vijay Vallabh School, I am extremely glad to welcome our guest, Dr. Shilpa Pagaria, for today's webinar. Ma'am is a dental surgeon and child specialist and graduated from MGV Dental College, Nasik. She has an extensive clinical experience of 18 plus years. Ma'am has worked as a head of department dentistry at Manipal Cure and Care at Koregaon Park and also at Noble Hospital at Magarpatta. She is an empanelist on various schools on medical panel like our own school, that is Acharya Shri Vijay Vallabh School, Muktangan and Symbiosis School. Ma'am has got certification in advanced rotary endodontics from Tulsa Dent, USA, grade from Singapore and Oscar Murphy International. Currently, Ma'am is practicing at Sahkar Nagar and Bibewadi branch under the name Enhancing Smiles at Dr. Pagaria's Smile Dental Clinic. Ma'am, we are really blessed to have you among this morning. Now, I request Ma'am to express her views. Over to you, Dr. Shilpa Pagaria.
Good morning, everyone. Thank you, Sonal ma'am. I'm really honored. My heartfelt thanks to respected Chairman Shri Subhashji Parmar sir, Principal Snehal Khatawkar ma'am, Sonal Khatawkar ma'am, and also the entire enthusiastic faculty at Acharya Shri Vijay Vallabh School for giving me this wonderful opportunity. I feel very happy to share and solve myths and queries regarding oral health. Coming to our today's topic, oral care for kids and teens. Oral hygiene is particularly important for kids, paving the way for healthy teeth and gums as they progress towards adulthood. This can result in lifetime good health. Taking care of our teeth starts early in childhood and extends throughout the course of our life. It is a combination of regular dental checkups along with developing good habits like brushing and flossing. Since 18 years at Dr. Pagaria's Smile Dental Clinic, we ensure that the teeth are clean, strong and white to keep you always smiling and confident. We use advanced technology and state-of-art equipment and materials for procedures like single visit root canal, fixed teeth, third molar removal surgeries, implants, lasers, tooth jewelry and many more. Well, while talking of teeth, one already has a question in mind that what is a cavity and how is it formed? ये cavity होती क्या है और बनती कैसे है? So, let's take a look at a small video explaining it. I request the technical team to kindly play the video.
Thank you, ma'am. Thank you, ma'am, for all your valuable views. Love your teeth. Celebrate your smile. Value your oral hygiene health. Be thankful for your healthy mouth. Visit your dentist. Repair your oral health problems. So, with this, let's move further and enhance smiles and oral care for kids and teens. Now, I hand over to Mrs. Varsha Gorule ma'am for the question answer session. Over to you, Varsha ma'am.
Unmute yourself, Varsha.
Thank you, Sonal ma'am. Good morning to one and all. It's indeed a great opportunity for me to be a part of this webinar and conduct the question and answer session. Here we begin with our first question of today's webinar. Now I request our parent, Mrs. Meenakshi Agarwal, to ask a question. Over to you, Meenakshi Agarwal.
Good morning all. My name is Meenakshi Agarwal. My daughter name is Yashika Agarwal. She is studying in junior KG. My question to you, ma'am, is what precautions should we take to protect our children from cavities in their teeth?
दांतों में कैविटी से बचने के लिए बच्चों में क्या सावधानियां बरतनी चाहिए? ओवर टू यू डॉक्टर शिल्पा मैम.
To start with a very good question, Mrs. Meenakshi. Well, to answer this, first let me share with you a slide. As the slide says, the tooth is the only part of our body that can't heal itself. We should protect them. I will rather share with you some tips to prevent cavities. As we all know, prevention is better than cure. So let's do that. These tips should definitely be useful for you. I would suggest if you make these and share it with your kids. The tips goes on as to start with. First, brush twice a day. Toothbrush. आप लोगों को ये ध्यान रखना है बच्चों में दिन में 2 बार ब्रशिंग की हैबिट स्टार्ट करें. Second is clean between the teeth daily to remove plaque from areas your toothbrush can't reach. Eat balanced diet. This helps keep your teeth and gums healthy. Coming to the diet part, I'll just talk briefly about it later. थोड़ी देर में मैं डाइट के बारे में आपको बोलूँगी. Replace your toothbrush every 3 months or sooner if the bristles begin to look worn out. यहाँ पे मैं और एक टिप शेयर करूँगी कि what is the right time to change your toothbrush. bristles flare हो रहे हैं, वो बिल्कुल झाड़ू की तरह लगने लगे, तो then this is the right time to change your brush. It may vary from person to person. हर इंसान में इस 3 months ही चेंज करना है. किसी में 4 months होगा, किसी में 8 months होगा. Depending on your bristles, you have to change your toothbrush. And but most importantly, visit your dentist at least twice a year for professional cleaning and थोड़ा जोर दूंगी क्योंकि बच्चों को साल में 2 वेकेशंस होते हैं, समर वेकेशन एंड दिवाली वेकेशन. तो मेक इट अ पॉइंट कि आप वेकेशन में एक बार जरूर आपके बच्चों को डेंटिस्ट के पास लेकर जाए. Coming to the diet part, you have to see to it कि आपका बच्चा जो भी फूड लेता है, it is fiber rich diet. That is, उसके डाइट में हो fresh fruits and vegetables, leafy vegetables, and plenty of water. Diet plays a very important role. एक और प्रिवेंशन की जब बात हम कर रहे हैं या प्रिकॉशन की बात कर रहे हैं, तो मैं और एक चीज यहाँ पे स्ट्रेस करना चाहूंगी, वो है सीलेंट्स. As you can see in this slide, बच्चों के टीथ में एक मटेरियल फिलअप करते हैं जिसको बोलते हैं सीलेंट्स. एज इट्स नेम सजेस्ट, ये जो बच्चों के दांतों में खड्डे होते हैं जिसको हम पिट्स एंड फिशर्स बोलते हैं, उसमें ये फ्लो करते हैं जिसकी वजह से उनमें कैविटीज नहीं होती है. बच्चे टिल द एज ऑफ 6 years दे स्टार्ट हैविंग देयर परमानेंट टीथ. उनके पक्के दांत आना शुरू हो जाते हैं एंड दे आर नॉट एज गुड एट ब्रशिंग एट दैट टाइम. इसलिए हम ये हमारे बच्चों में सीलेंट्स भरते हैं जिसकी वजह से उनके दांतों में कैविटीज ना हो. इट स्टेज till your child grows up a little more and can brush nicely. Trust me, this is a very effective method. I have tried it for my own kid when she was 3 years. So I would recommend कि जब भी आपके डेंटिस्ट के पास जाए तो make sure to ask the dentist about this. Thank you.
Thank you,
Over
ma'am.
to you, Asha, ma'am.
Thank you, ma'am. Yes, ma'am. Prevention is better than cure. And whatever tips you have shared are worth, and we definitely will follow it. Now our parent, Mrs. Vijeta Shah, would like to ask her question. Over to you, Vijeta Shah.
Thank you, ma'am. Good morning, ma'am. My name is Vijeta Shah. My child name is Arav Shah. He is studying in 4th standard. My question is, which kind of toothbrush and toothpaste suitable for the children?
बच्चों के लिए कौन सा टूथपेस्ट और टूथब्रश उपयुक्त है? Over to you, Dr. Shilpa, ma'am.
Yeah. Thank you, Mrs. Shah. Well, looking for a toothbrush, always go for a brush with soft or medium bristles. Hard bristles color toothbrush is not recommended at all. For toothpaste, बच्चों के लिए देखते वक्त see to it कि उनके टूथपेस्ट में फ्लोराइड हो. Ask for a fluoridated toothpaste. Till 7 years of age, you have to give them kids toothpaste. Do not start with adult toothpaste क्योंकि वो इतने अच्छे नहीं कर पाते हैं till the age of 7 years. So they tend to swallow some amount of toothpaste, which is not good for their health. You have many fluoridated toothpaste in market, something like Cheerio Gel, Kidodent, or even Colgate का है, Colgate Kids toothpaste. All the pastes in the market are good and almost same. What matters more from my angle is how you brush your teeth rather than with what you brush your teeth. I would really like the kids to see this interesting video. May I request the technical team to play the video, please?
In this video, we'll show you the best way not only to brush your own teeth, but also how to easily brush the teeth of others. Toothbrushing should be carried out twice a day, in the morning and last thing at night. We must remember that not everyone can brush their own teeth. But when brushing other people's teeth, the principles are the same. Please remember that toothbrushing takes a full 2 minutes. Yes, 2 minutes. Use a small-headed, medium-texture bristles toothbrush with a small amount of fluoride toothpaste. Start by tilting the toothbrush against your teeth so the bristles are at a 45-degree angle to the gum line. Move the brush in small circular movements, a few times on each tooth. Next, brush the outer surfaces of each tooth, keeping the bristles angled against the gum line. Do the same thing for the inside surfaces of all the teeth. Now, brush the biting surfaces of the teeth, on the top and the bottom. To clean the inside surface of the front teeth, tilt the brush vertically for the upper teeth. Gently move the brush long ways down the tooth from the gum for a few seconds. For the lower teeth, tilt the brush vertically and pull the toothbrush gently upwards from the gum for a few seconds. If plaque is not removed from the teeth, it leads to bleeding gums and tooth loss. If you eat or drink sweet things, plaque mixes with the sugar and causes tooth decay. Finally, spit out any remaining toothpaste. Do not rinse the mouth with water or any kind of mouthwash. In this way, the fluoride in the toothpaste will help protect the teeth.
Thank you, Shilpa ma'am. Thank you, Shilpa ma'am. This information will surely help our parents to select the right toothpaste and toothbrush that is suitable for their children. Now our parent, Mrs. Vinita Kering, would like to ask a question. Over to you, Vinita Kering.
Good morning, everyone. My name is Vinita Jitendra Kering. My child name is Prachi Jitendra Kering. She is studying in standard 3rd. My question to you, ma'am, is it safe to go for a dental treatment during this COVID pandemic?
क्या इस कोविड महामारी के दौरान डेंटल ट्रीटमेंट के लिए जाना सुरक्षित है? Over to you, doctor.
Thank you, Mrs. Kering. Yes, it is absolutely safe to go for a dental treatment even in pandemic. चाहे कोरोना हो या कोई भी पैंडेमिक हो. Even before this pandemic, this corona, dentists were mandatorily using face masks, gloves and aprons. They were taking utmost care of hygiene and disinfection. Yes, there are a few more protocols set by IDA for all of us, like checking oxygen saturation, temperature, disinfecting chairs, our surroundings, waiting rooms, etc. We make it a point to keep breaks in between 2 appointments. As for the patient, as for you, see to it that you are asymptomatic. आपको भी सर्दी, खांसी, बुखार ना हो. Appointment लेकर ही clinic पर जाइए, so that you need not have to sit in the waiting room or come in contact with other people. Use a sanitizer and try not to touch the furniture or anything surrounding in the waiting room. Let me tell you one thing. Dentist is at more risk than you. They too have their kids and family, so they take more necessary precautions. So you can be बिल्कुल बिंदास होकर आप डेंटिस्ट के पास ट्रीटमेंट के लिए जा सकते हैं, even during any pandemic. Over to you, Varsha ma'am.
Thank you, ma'am, for guiding us for the dental treatment during this pandemic situation, which is really a need of an hour. Now our student Heath Shah would like to ask a question. Over to you, Heath.
Thank you, ma'am. Good morning. My name is Heath Shah. I am studying in 9th standard. My question is to ma'am is that when I drink cold water or cold drink, there is a severe pain in my teeth. What should be the reason for it?
जब मैं ठंडा पानी या कोई कोल्ड ड्रिंक पीता हूँ तो मेरे दांतों में तेज दर्द होता है. इसका क्या कारण हो सकता है? Over to you, Shilpa ma'am.
Thank you. Thank you, Heath, for the nice question. Yes, you may feel sensitivity at times on eating hot, cold or citrus food. ठंडा, गरम या खट्टा खाने पर झंझनाहट सी होती है. That is what the Sensodyne का ad says. First thing you should do is see a dentist. कि कहीं cavity तो नहीं है. If assured that it is not a cavity, then it is tooth sensitivity. It's because आपके टूथ का हार्डेस्ट टॉप लेयर जो होता है इनैमल वो घिस जाता है. लेट मी शेयर विथ यू अ स्क्रीन ओवर हियर. See in this picture, जो हार्ड इनैमल होता है टॉप लेयर वो घिस जाता है या टूट जाता है. या दूसरा रीजन हो सकता है कि आपके जो गम्स है मसूड़े है वो घिस चुके. तो इन दैट केस अगर माइल्ड सेंसिटिविटी है तो आपको डिसेंसिटाइजिंग टूथपेस्ट और माउथ वॉश यूज करना चाहिए. अगर सीवियर है तो टॉक टू योर डेंटिस्ट. The dentist will treat you accordingly. One of the reason for sensitivity can be harsh brushing. जो बहुत ज़ोर से अपने दांत घिसते हैं या बहुत ज़्यादा देर तक घिसते हैं उनमें भी ये प्रॉब्लम हो सकती है. So I would really recommend कि आप आपके डेंटिस्ट को मिले और रियल प्रॉब्लम क्या है वो फाइंड आउट करें. थैंक यू ही. ओवर टू यू वर्षा मैम.
Yes, ma'am. A very good explanation is given. Now we are aware of the reason why our teeth pains when we drink cold water and how to manage the sensitive teeth. Now, ma'am, I'm also very eager to ask you one question. Which treatment is better option? To do root canal or to remove the tooth? Sometimes even if we do root canal, pain continues to remain. So what is the reason for that? कौन सा उपचार बेहतर विकल्प है, रूट कैनाल करना या दांत निकालना? कभी कभी हम रूट कैनाल करते हैं तो भी दांतों में दर्द बना रहता है, तो इसका क्या कारण हो सकता है मैम? ओवर टू यू मैम.
थैंक यू वर्षा मैम. वेल, फर्स्ट लेट मी शेयर विद यू अ स्क्रीन. ये बिना दांत वाला फोटो बच्चों को ही अच्छा दिखता है. वेल, जोक्स अपार्ट, इट इज ऑलवेज बेटर कि अगर ऑप्शन दिया जाए आपको कि आपको दांत बचाना है तो दांत निकालना नहीं बल्कि रूट कैनाल करके उसे सेव करना. लेट मी टेल यू रूट कैनाल मतलब क्या होता है. सो आई विल बी able to explain you in a better way. में देख सकते हैं जब कैविटी जो कीट लगता है दांतों में नस तक स्प्रेड हो जाती है तो नीचे इन्फेक्शन हो जाता है. तो इस केस में यू आर लेफ्ट विथ ओनली टू ऑप्शंस. या तो आप दांत निकाल दे जिसके साथ वो अंदर की सड़ी हुई नस भी चली जाती है, या तो फिर जो आपके दांत का अंदर की खराब नस होती है उसे हम करते हैं पर दांत वैसा ही रहता है. जहां जिस पार्ट से हम नस निकाल देते हैं विद स्पेशल उसको हम वापस भर देते हैं. इसका फायदा ये होता है कि क्योंकि दांत में नस नहीं है तो दर्द तो नहीं होता बट फंक्शन द टूथ बिहाइंड, वो अपना काम चालू रखता है. सो इट इज ऑलवेज बेटर कि आप रूट कैनाल करके दांत को बचाएं. एंड एज आई हैव टोल्ड यू रूट कैनाल प्रोसीजर में अगर सही ढंग से किया जाए, अगर सिंगल विजिट, द वे आई डू इट इज इन अ सिंगल विजिट, वी मेक इट अ पॉइंट कि दांत के अंदर कोई नस ही ना रहे तो बाद में दांत पेन करने का कोई कारण ही नहीं बनता है. अगर पेन है तो इट इज बिकॉज माइट बी इट इज नॉट डन इन द करेक्ट वे या फिर उसके अंदर कोई और रीजन हो सकता है. यू नीड टू आस्क योर डेंटिस्ट अगेन, बट आई कैन अश्योर यू वन थिंग, अगर प्रॉपर वे में रूट कैनाल किया है तो वह पेन कभी नहीं करेगा वापस. एंड आई वुड स्टिल रिकमेंड कि जब भी पॉसिबल हो आप रूट कैनाल करके टूथ को सेव करें, निकालें नहीं. ओवर टू यू वर्षा मैम.
Thank you, ma'am, for the valuable information given to me regarding root canal treatment rather than removing the tooth if not necessary. And if pain continues, it is better to consult the dentist. Now our parent, Mrs. Bhagyavanti Jain, would like to ask a question. Over to you, Bhagyavanti Jain.
Thank you, ma'am. Good morning, everyone. My name is Khushi. My name is Bhagyavanti Jain. My child name is Khushi. She is studying in 4th standard. My question to you, ma'am, is which home remedies do you suggest for dental care?
दांतों की देखभाल के लिए आप कौन से घरेलू उपचार सजेस्ट करते हो? Over to you, Dr. Shilpa ma'am.
Yes. Thank you, Mrs. Jain. But let me tell you, this is the most commonly asked question. But the answer is very, very simple. Brushing twice daily is the only effective and using a mouthwash twice a week. Mouthwash भी आपको daily use नहीं करना है. It has to be 2 to 3 times a week. Nothing else works the best than this. जो घरेलू उपचार है जैसे एलम यानी कि तुरटी का पानी और फॉल्स रिलीफ मिलता है, वो आपके दांतों के लिए कोई नहीं है. एक लेटेस्ट मैंने सुना है कि लोग नमक और सोडा मिक्स करके दांतों पे घिसते हैं टू हैव दैट टीथ व्हाइटनिंग. बट लेट मी टेल यू कि आपके दांतों के लिए बिल्कुल भी ठीक नहीं है. वो दांतों को और घिसता है और उससे सेंसिटिविटी बढ़ेगी. So let me tell you, nothing else really works better than mouthwash. अभी जो मैंने आपसे कुछ देर पहले वीडियो शेयर किया है, if you brush according to that technique, trust me, you won't need anything else. Over to you, Varsha ma'am.
Thank you, ma'am, for the wonderful. Thank you, ma'am, for the home remedies that you have suggested, which are easily available for us at home. Now our parent, Mrs. Bhavna Rathod, would like to ask a question. Over to you, Bhavna Rathod.
Good morning, ma'am. My name is Bhavna Rathod. My child name is Reshna Rathod. She is studying 3rd. My question is, nowadays, most of the children are going under the treatment of braces. How effective is it?
आजकल के पेरेंट्स अपने बच्चों को ब्रेसेस लगवाना प्रेफर करते हैं, तो वो कितना इफेक्टिव हो सकता है? ओवर टू यू, डॉक्टर शिल्पा मैम.
Thank you, Mrs. Rathod, for the question. As we all are aware of our changing food habits, raw food is naturally shifted to fast food. And also there are few other reasons. होता क्या है कि इन these kids, जो ये जनरेशन के बच्चे हैं, इनमें मिल्क टीथ जल्दी गिरते नहीं हैं, उसके पहले ही permanent teeth आ जाते हैं. The milk teeth don't shed off at a desired age, but the permanent tooth is ready to erupt. Jaw size limited होता है, वो milk teeth और permanent teeth दोनों को साथ में accommodate नहीं कर पाता है. And so जो permanent teeth आता है, वो अपने किसी और ही फैशन में बाहर आता है. कभी वो होठ की तरफ आता है, कभी गाल की तरफ से ही बाहर आ जाता है. It is out of the jaw line. बट एट लेटर एज ये प्रॉब्लम क्रिएट करता है. वो प्रॉपर हाइजीन नहीं मेंटेन कर सकते हैं. ईटिंग चूइंग बिकम्स अ प्रॉब्लम लेटर ऑन. एंड ऑल्सो यू मे फेस विद गम्स प्रॉब्लम. कुछ लोगों में हमने देखा है कि इवन इफ दे आर इन देयर 40s दे हैव द प्रॉब्लम ऑफ मूविंग टीथ. पहले तो दांत बहुत पास पास में थे, क्राउडेड थे, एंड देन लेटर ऑन वो जल्दी ही हिलने लग जाते हैं. If you don't go for this treatment, yes, you may face with that problem. And also, you may face with gums problem. कुछ लोगों में हमने देखा है कि इवन इफ दे आर इन देयर 40s दे हैव द प्रॉब्लम ऑफ मूविंग टीथ. पहले तो दांत बहुत पास पास में थे, क्राउडेड थे, एंड देन लेटर ऑन वो जल्दी ही हिलने लग जाते हैं. If you don't go for this treatment, yes, you may face with that problem. Let me share you the options for braces in a very brief way. Braces on your teeth. एक होता है metal, the other one metal में आपको brackets दांतों पर होते हैं and you cannot visible दांत के जैसे वो नजर आता है. यहाँ पे मैं आपके साथ एडवांस टेक्निक भी शेयर करूंगी फॉर ब्रेसेस जो आजकल हम YouTube या इस पर देखते हैं. परिणीति चोपड़ा की व्हाट यू यूज एक ट्रांसपेरेंट ट्रे जैसा होता है जो आपके दांतों पर जाता है. कोई तकलीफ नहीं होती है, प्लस सामने वाले को वो नजर भी नहीं आता है. You are using some aligner for your teeth straightening. So this is much more level of comfort for aligners and braces. And yes, it is very effective. Later on, for में gums नहीं होंगे if you go for this treatment. At the time, aesthetic यानी appearance जो होता है, जो आजकल का college crowd या young crowd होते हैं, it helps in that. आपकी smile और होती है. अगर आप सोच रहे हैं कि क्या ये इंडिया में ही कौन है, तो let me tell you, in US, out of 10, 7 kids have got braces. It is an awareness which is causing people more and more to go for this treatment. And yes, it is effective. It really helps. Definitely in improving your appearance and boosting up your confidence. Thank you. Over to you, Varsha ma'am.
Thank you, ma'am, for the wonderful solution you have given us about treatment for braces. Now I request our principal, Mrs. Snehal Khatakar, ma'am, to ask the question. Over to you, Snehal, ma'am.
Yes, ma'am. Why is the dental treatment so expensive nowadays? Dental treatment इतना महंगा क्यों है आजकल? Over to you, Shilpa, ma'am.
Over to Dr. Shilpa, ma'am. I request our principal.
Hello, ma'am. Why is the dental treatment so expensive nowadays? Dental treatment इतना महंगा क्यों है? Over to you, Shilpa, ma'am.
You are asking this to a dentist. It's not treatment that are costly. The things that we use are imported. durability.
Ma'am. Hello, Shilpa ma'am.
Yes, yes. Please carry on. I'm really.
I'll just repeat my question once again.
Please go ahead.
Why is the dental treatment so costly nowadays? Dental treatment इतना महंगा क्यों है? Over to you, Shilpa ma'am.
As I was trying to explain, it is not the treatment, but the equipments and the materials that are costly. What all we use, ये सारी चीजें imported है. We want strength, durability, and at the same time, it should be aesthetic. यानी कि टिकाऊ भी हो, अच्छा भी हो, और स्माइल करे तो पता भी नहीं चले. It should look that natural. बस उसी चीज़ की कॉस्ट है. I always tell my patients, आप दाम की जगह काम को देखो. See the skill. आप जब पूरे कॉन्शियस होते हैं तब आपके मुंह में डेंटिस्ट एक टाइप की सर्जरी ही कर रहे होते हैं. अगर आप ज़रा भी हिल जाए तो हमें बहुत कॉशियस रहना होता है. पीछे होता है आपका गला, एक साइड में टंग, एक साइड में चीक. कहीं गलती से भी लगना नहीं चाहिए. ये बहुत प्रिसाइज और डेलिकेट काम है, which needs utmost skill. I think dentist has the right to charge you for that if they guarantee you safety. It's justified. Over to you, Varsha ma'am.
Yes, very true, ma'am. Now we came to know why dental treatment is so costly. Just because the dental treatment is expensive, nobody should wait for it. We should do it, otherwise it may lead to the harmful dental consequences. Over to you, Varsha.
Thank you, Snehal ma'am. Our teacher, Mrs. Bhavika Rathod, would like to ask a question. Over to you, Bhavika miss.
Good morning, ma'am. I, Bhavika Rathod, teacher at Acharya Shri Vijayavallabh School, would like to ask you a question. What is modern dentistry or advanced dental treatment?
आधुनिक दंत चिकित्सा या उन्नत दंत चिकित्सा क्या है? Over to you, Dr. Shilpa ma'am.
Yes. Thank you, Bhavika ma'am, for the wonderful question. Technology बहुत एडवांस हो गई है. Procedures are almost painless now. Aesthetics and beauty का ज़्यादा ध्यान रखा जाता है. Beauty की बात करें तो for a wonderful smile, we have come up with two jewelry. Let me share the screen with you. Just a minute. I'm sorry, I'm not able to share it with you because of some technical issues. Well, two jewelry is a Swarovski diamond. It's a European diamond that is put on your front teeth. जो आपके स्माइल को 4 चांद लगा दे। बिल्कुल सेफ है। जैसे बोलते थे कि पहले अगर डायमंड पेट में चला जाए और unintentionally if you swallow it can be poisonous, but it is not with Swarovski. Trust me, it is absolutely safe. As you can see, I myself have put it on my tooth, so don't worry. To name other fews, we have implants, जहाँ पर बोन के अंदर ही स्क्रू डालकर दांत बिठाते हैं ताकि आपको नेचुरल फील और नेचुरल लुक दोनों मिले। ऑल्सो वी आर कमिंग अप विथ लेजर्स, जहाँ वी प्लान कि दांतों की ट्रीटमेंट ब्लडलेस हो या विद मिनिमम ब्लड लॉस हो। ऑफ कोर्स पेनलेस तो है ही। सो दीज आर अ फ्यू थिंग्स दैट वी आर कमिंग अप एज वी हैव टॉक्ड इवन बिफोर अबाउट अलाइनर्स, यानी कि ब्रेसेस जो ट्रांसपेरेंट है, आपको पता भी नहीं पड़ेगा कि सामने वाले ने ब्रेसेस लगाया है। These are a few things. In the end, everything for your betterment, to enhance your confidence and smile. Thank you.
Thank you, Shilpa ma'am, for sharing your views on modern dentistry and advanced dental treatment. Thank you, doctor, for a wonderful and informative session. Now I request our principal, Mrs. Snehal Khataukar ma'am, to share her thoughts on today's webinar. Over to you, ma'am.
I thank you, doctor, for enlightening us on the topic dental health. Really, we came to know what precautions should we take to protect our teeth to be fit and fine, and what home remedies should be followed. सच में स्वस्थमुखी सेहत का आधार है। I'm sure all the dental tips given by you will be helpful for all the students and parents as well. Really, such kind of webinars motivate us to gain more knowledge. Thank you, ma'am. Thank you once again.
Now I request Sonal to propose the vote of thanks.
Thank you, Varsha ma'am. Saying thank you expresses gratitude, humility, and understanding. So, I, Sonal Khabia, on behalf of Acharya Shri Vijay Vallabh School, consider it a great privilege to propose a vote of thanks to acknowledge the contribution of those who worked hard to this webinar on the dental health. Let's build a confident smile, organized by Acharya Shri Vijay Vallabh School. Let me first of all start by giving glory to the Almighty God for making today's webinar a resounding success. My heart fills with lots of gratitude and respect to thank our today's speaker, Dr. Shilpa Pagaria, for guiding us with her commendable talk on dental health. Really, today's webinar was creditable, full of knowledge, and very useful. It gave deep insight into the topic, and the way the ma'am explained the topic was amazing, which properly highlighted and also solved our myths regarding dental care. A heartfelt thanks to our chairman, Sri Subhashji Parmar sir, committee members, trust members, principals, teachers, and dear students for their enormous support. A special thanks to our technical team for their unflinching support and coordination to make this webinar a resounding success. Thank you all, enthusiastic and encouraging viewers, for joining us to Facebook Live and appreciating us by your valuable comments. With these warm words and a kind message, we move to an end of our today's fascinating webinar. Once again, thank you all for your cordial cooperation and have a good day ahead. Stay tuned further with Acharya Shri Vijay Vallabh School for more knowledgeable Sunday webinars. Thank you.
Acharya Shri Vijay Vallabh School, Pune, India. Thanks all our viewers for giving their overwhelming response. Thanks to our today's eminent speaker. A special thanks to our chairman, Shri Subhash Ji Parmar. A big thanks to our organizing team, Mrs. Snehal Khataukar, Principal, Mr. Kalpesh Darji, Team Leader, Mrs. Varsha Gorole, Teacher, Mrs. Sonal Khabia, Teacher, Mrs. Itisha Shah, Teacher, Miss Bhavika Rathod, Teacher, Miss Urvisha Rathod, Teacher, Mrs. Aparna Dhaigude, Team Member. Once again, thank you all. Thank you all the viewers for watching this webinar. We look forward seeing you next Sunday for yet another interesting webinar. Till then, stay tuned. Thank you.